Hi. How are you?
I'm good. What are your innermost thoughts? So as a lot of you probably already know, we are using the ketogenic diet as well as other metabolic therapies in an effort to treat my schizoaffective disorder, my mental illness. And so we just wanted to kind of give a little bit of an update on how it's going, what we're struggling with, and what's going well.
Yeah, so I mean, things have been moving pretty quickly over the last 2 to 3 weeks. We've been trying to capture a lot of it in video, but also trying to keep up with that is a bit of a different experience for us too, creating.
We're not used to vlogging. Hopefully you've been enjoying the content, but it's a learning curve, getting used to documenting our daily life.
Yeah, I feel like there's been a lot of let's record this, and we record it and we're like, that's not very good, or that doesn't make sense, and then we throw it out or do it over again, or that kind of thing.
Cut that.
We'll cut that. We're gonna cut that. So how are your ketones doing today?
I don't even know. I don't know. Not doing this very well. So my continuous ketone monitor, this bad boy, is saying 2.4 right now. Highest has been 3.2, but that's a little low actually for me right now. But I've also found that that's been lower than the blood monitor, the Keto Mojo. The last time I took my ketones was this morning and it was 3.8. So it's probably around the threes, low threes. My keto coach asked me yesterday, I think it was, well, okay, how are you feeling at the different ketone levels? And just a reminder, the ketone levels are how much ketones your body is producing off of the fat that it's burning for fuel. And ketones are what fuels your body and your brain when you're on keto. And I was like, oh, I haven't really actually been taking note of that, how my body's feeling at the different ketone levels. So that's something I want to be more cognizant of moving forward, is how my body's feeling at the different ketone levels. But as a whole, just kind of how I've been feeling in general with using ketones as fuel and using fat for fuel and this whole switch to the ketogenic diet, I'm hesitant to say that I've been feeling really, really good. And I've worded it to you as I just feel really stable. And I'm definitely experiencing a reduction in symptoms. And the reason why I feel hesitant to say that is because it does feel like it's really, really early in this process. And I wasn't even fully sure if this would actually be effective. It seems a little bit too good to be true to change your diet and put your serious chronic mental illness into remission. And I'm definitely not there yet where I'm willing to say it's in remission and whatnot, but I am definitely noticing changes, and changes for the better.
It'll be interesting to note where you're at the 6 to 8 month mark, if this is kind of where you're at right now. And that's what Nicole was talking about.
Yeah, Nicole was saying that it's typical, or it's common for people to experience these changes very early on in the process. But, peak levels of beneficial changes commonly around the 4 to even 8 month period. So if I'm feeling this much difference already, I'm cautiously, extremely optimistic for what it's going to look like at the 4 to 6 month period.
I was reading some comments in recent videos, and people were making comments about how they feel like there's already a difference just in your personality. So I don't know. That's
part of that might just be that we're sharing more of our everyday life, and so there is a bit more of my personality being injected into these videos. You're catching me in moments of happiness and whatever that may be. So
not just the typical
not just my zombie presentation of boring schizophrenia facts. Yeah, who knows? I think I would probably take that feedback a little bit more from people in my life. So I don't know. Have you noticed any changes in me over the last several weeks?
Well, I think I have to preface that with also feeling like my experience hasn't been on the same level as yours. And so, I think that it's been a bit more of a difficult experience for me, and I've been a little bit more tired. And so I don't know that I'm the best actual gauge of that, because I've been more irritable and whatnot. So it's hard And I see you every day, like the changes are a little bit more difficult to notice.
Right.
But yeah.
Well, do you want to talk about your experience then? What has your experience been like getting into ketosis? What are you feeling?
Yeah, I mean,
Rob does not live with a mental illness.
my ketones are actually, I think, about the same as yours right now, like 2.2, whatever. But in general, mine are lower. Like you're, I think, more in like 3s and above, and I'm usually more like 1.8 and above, just based on like the continuous ketone monitor, which I also am testing with like the Keto Mojo, like the blood prick test, and it's kind of close. And I would say that I notice that I do generally feel a little bit more better, like a little bit more energy when my ketones are higher. But on average, they're maybe more on the lower side, like more on the like 1.7 to 2 range. And then they spike up and I feel better. And then overall, I feel like my energy is still kind of low. Like I haven't made like this kind of full switch into keto. And so, yeah, I'm kind of more on the like tired side still. And I am feeling, it's weird because I think at night, and this is probably both of us, but maybe things are changing. Like we feel the difficulty like getting to bed. And so I've been going to bed later. I still haven't my sleep hasn't regulated. And that's something that kind of need to focus on more.
That's actually something that is changing for me. So that is definitely something that I experienced in the first couple weeks of switching to keto, was this kind of feeling wired at bedtime. I was tired, but I still felt wired and like I could just stay up all night and it would be no problem. But that's actually going away a little bit. Like last night, I think I went to bed at like 9:30 and it was no problem at all. I was tired and my body wanted to rest. So I think that might be like an adjustment period, and something to watch out for if you're susceptible to mania as well, is really staying on top of that period where you feel the wired, not restlessness, but just energy, I guess.
What about, one thing that I have noticed is reduction in inflammation and in my body. And so, for example, I mean, I'm 8 years older than you. You like to make fun of my age all the time. But, I'm 40 years old, and before keto, over the past, I want to say like 3-4 years, like I notice more joint pain, and I take like glucosamine supplements to like try to like deal with that. But I noticed kind of immediately over the last, I guess, 2 weeks, like reduction in inflammation in my joints specifically. So like no knee pain really at all. Like walking up the stairs, you don't notice it. What I do notice is like, it feels like my muscles are kind of starved for oxygen, if I could say that's how I would describe it, just kind of like burn more. And I think that has more to do with just my body still adapting to
switching fuel sources. Mm-hmm. Yeah.
But notice reduction in inflammation.
I think I've more noticed that in terms of like the appearance of my body, in terms of like less bloat. My muscles are looking like more toned.
Well, we both lost weight too. Like
I've actually lost like a minimal amount of weight. I think really the shift is more in how my body is looking.
You look great.
Oh, thanks. But I don't want that to be the focus at all, because that's really not why we're doing this. You are actually losing weight, and you don't really want to be. You want to be putting on weight. So that's of note, I guess. I talked to Nicole, my keto coach, about, like we're losing weight. Is this normal? Will it stop? And she said, yeah, it's usually normal. Your body is just using up the excess fat that it has. So it will get to a point where we'll plateau and stop burning the fat off of our body. But yeah, I think you need to be eating more fat and stuff. Mm-hmm. We have different macros because obviously we have different body sizes or composition or whatever. And so you've been having a hard time hitting, I think it's like 200 grams of fat a day.
Mm-hmm. Yeah, like we have the same macros for carbohydrates, which is 20 net grams, but I have like 50 grams more fat and I don't know, maybe like 40 grams more protein to try to like hit each day. And it's a bit of a challenge. It's a bit of a challenge. Like if you could eat as much as you wanted for carbohydrates, I think it'd be easy to hit that. But trying to like hit that amount of fat while also staying like low carbohydrates, it just ends up being, I feel like, a lot of fat.
So what has this diet switch been like for you in terms of eating very minimal carbs and trying to kind of switch up the way you make meals and consume food?
We've talked about this, like,
yeah, but we're doing it for people on the internet now.
Yeah, okay. Yeah. Thanks. I mean, you know the answer to that. Yeah. So why are we even talking? Why
are we talking? We do talk off camera. And
so like talking about kind of what it's like eating like 20 grams net carbs. Like, and we did this actually before. Like the first time we did keto, 20 grams net carbs was our target. But I'm not really sure how we did it. Like it does feel like we're eating different than we ate before. Like it feels like tighter
I think we're much more focused on whole foods. I think we were still eating a lot of like processed foods the last time around. And I think that that's probably actually a large part of why I'm feeling really good right now is because we are focusing on whole foods and organic where we can and trying to be mindful of that and moving away from fast foods and processed foods and whatnot.
But still, 20 grams net carbs is astonishingly low. And I'm sure that there's like, if you look that up on Google or you look at comparison things to see like what contains 20 grams of carbs, you'll see like how little it is. And like we had broccoli and sausage, just broccoli and sausage the other day. And I had too much and I like blew past my carbs.
I think it was like 17 grams of carbs in that one meal.
Like there's actually a lot, like in a bowl full of broccoli, there's probably 5 or 6 grams of
And we're
carbs.
talking net carbs. So that's not even accounting for like fiber and stuff, which doesn't count towards net carbs.
So it's not like all you can eat vegetables or anything. It's like even vegetables, it's like a low carb vegetable and a specific amount of low carb vegetables. And then you're figuring out, how do I get more fat into this meal and not too much protein? Because if you have too much protein, that's not good either.
It'll knock you out of ketosis.
Yeah. So it's been an adjustment in terms of kind of, I think, paying attention to those things. And it doesn't feel intuitive at all. Like we're very much still in this phase where we're weighing everything, and that gets a little tedious after a while. But it's not difficult. It just gets a little tedious sometimes. You're fine with it. And
I don't mind it at all, but that is something that is probably worth touching on in terms of like the element of weighing and tracking all of your food. And there's been a lot of people in the comments saying things like, this is triggering my eating disorder, or being worried about my eating disorder being triggered and being concerned for themselves trying it out for fear that their eating disorder will be triggered, and a lot of focus on that and worry over that. And so, yeah, I think that's a real concern, because when you're tracking food, I was tracking food in the heyday of my eating disorder, and I was very fixated on that. And it almost looks like that now again, where I am very conscious.
You have to be though, yeah.
It looks like it did when I had my eating disorder. That I'm being very conscious of what exactly I'm putting into my body. I'm weighing it all. I'm tracking it. But I brought this up because Rob was actually concerned with me being a little bit too focused on hitting below my carbs. And so I brought it up with Nicole, and she kind of talked me through it and was like, well, it's only really a concern when it gets to a point where you're feeling like carbs are evil, carbs are bad, or, having trains of thoughts like that. That's kind of goes hand in hand with an eating disorder where you feel that high calorie is bad or whatever it is for your particular eating disorder. And where I'm at currently with this is really more like a curious exploration of what I'm fueling my body with. And I really, there's a lot of research on how the keto diet is actually an effective treatment for eating disorders like anorexia. And when I first heard about that, I was like, what? Like, that doesn't really make sense to me. But I would really recommend you go and check out the YouTube channel Metabolic Mind. They have a lot of videos on keto for anorexia and the research behind it and whatnot. But, going through this, I can kind of understand it a little bit because it's kind of relearning what it means to fuel my body and almost creating a healthier relationship with food as fuel and how it's affecting my body and wanting to make that as healthy an exchange as possible. So I get where people's concerns are coming from, but it has not been an issue for me. And it actually is research based that it is an effective treatment for many eating disorders.
I know that I think I'm dealing with some dissonance here with respect to the amount of fat that you need to eat. And I think that kind of comes built up with this idea that fat's not good for you.
Yeah.
And we're having to eat fat bombs multiple times a day.
We're popping multiple fat bombs a day, which is basically cream cheese, butter, almond butter, and erythritol sugar, not real sugar, monk fruit sugar. And everything we've been taught previously is that is awful for your body. You should not be consuming that. But this is actually what our bodies are craving now and what they're using for fuel. Mm-hmm. So interesting mind shift going on. And there's also been a lot of people in the comments being like, there's no way this is healthy. You need a balanced diet. And I hear you that's what we've been taught and fed all of our life, that we need, all the food groups and we need carbs and whatnot. But if you dig into the research behind this, and hopefully we will be sharing more of that on this channel and through this project, you really don't necessarily need all of that. And the way
it depends. Nobody would eat the amount of fat that we're eating, but also be eating carbohydrates.
Yes. But because we've taken out carbohydrates and our body is using fat for fuel, mm-hmm. it is a lot healthier and necessary to consume high volumes of fat. Mm-hmm. And, back to the concerns around the eating disorder, I do want to explore this more in depth for people who have, strong concerns around this. And so we will be creating a whole separate video full of the research that I'm alluding to around how it's used in the treatment of eating disorders like anorexia. So stay tuned for that video.
So any major concerns so far or, concerns going forward?
I think from the get-go, I was concerned about how athletics would fit into this. I'm fairly active, you were fairly active, and we were wondering how that switch away from fueling our body with carbohydrates, which again, we're taught is what you need for, physical activity and endurance and whatnot. We're wondering how that was going to go. I've been running very regularly through all this, and it's been pretty good. I have felt maybe a little bit more tired when I'm pushing the pace. And my heart rate has actually been a little bit higher too. So unsure of that. Again, we are wanting to have a specialist nutritionist who specializes in keto for athletes to come on. So stay tuned for that as well. But we actually just joined the gym this week because we're wanting to work that into our physical activity repertoire routine as well. And so we are wondering, and we will be sharing with you also how being on keto and using fat for fuel and no carbohydrates plays out when doing more anaerobic exercises and weightlifting and whatnot. Another concern is actually not really to do with keto. It's more to do with the balance of my medication. And that's probably something important to note as well, is that there's been a lot of people asking if I'm still on medication, if I stopped medication when I started keto. And to clear things up, I have not touched my medication at all.
As in you've been taking it?
Sorry, yeah, that was confusing. I touch it every night when I consume it, but I just mean I haven't changed anything at all with my medication. I'm still on the same medication and the same dose that I was taking before keto, but I'm actually starting to notice that I'm experiencing more sedation, especially in the mornings because I take my medication at night. So the sedating effects are kind of still lingering in the morning time. And so I brought that up with Nicole and kind of asked her, when is too early to start talking about reducing meds? And she was very clear, she's not a prescriber, so she couldn't say that, but she's actually working in conjunction with my psychiatrist, my prescriber. They're going to be having a talk about how to manage it. But she recommended I talk to my psychiatrist about potentially starting to very, very gradually reduce my medication to hopefully alleviate some of that sedation that I'm experiencing. So I was not anticipating that at all. I thought that we would be starting to adjust medication maybe like 6 months in when everything is super stable. But I think that my body is kind of compensating for, how do I explain this? Some of
the therapeutic effects of the ketogenic
therapeutic
diet.
effects. Yeah. I'm already experiencing some therapeutic effects. And so I'm actually now kind of over medicated, which is why I'm experiencing more sedation. That's my understanding. We'll talk with my psychiatrist as well more about that and report back.
So at this point so far, what are your thoughts on kind of the accessibility of this therapy for other people? Yeah.
Who maybe don't have a keto coach and...
Yeah. And I guess also taking into account, like, from what I have read in a few different areas, that compliance as, like, if you're prescribed the ketogenic diet as a treatment, that compliance is a big issue that that medical practitioners kind of cite as to why they wouldn't prescribe it, that it's difficult to follow and difficult for their patients to keep up with. And I mean, what are your thoughts on that?
I think that there are elements around it. Like, we tried this back in 2020 and we did not do a good job. I think largely because we did not have enough education around what medical keto really entails. And so perhaps that's a piece that makes it a little less accessible, because there are not a lot of practitioners out there who know a lot about implementing the keto diet and the medical keto diet as a therapeutic intervention for mental illness.
And a lot of information about keto is keto as a diet for weight loss, not keto as a medical
which is very different. And so that perhaps reduces accessibility, but it's my hope that this project on our YouTube channel is kind of showing people perhaps a little bit of how they could do it at home and sharing more of that information and resources. But yeah, like, working with Nicole has been very, very helpful in terms of being able to check in and make sure I'm on the right track and all that sort of stuff.
And the medical specific questions.
Yeah. So that's been really helpful. And hopefully we'll be able to share more of that on the channel so that we can share that knowledge with you all as well. In terms of it being difficult around compliance, I think that it is a big lifestyle change. It does ask a lot of you in terms of the changes that you need to make for it to be effective. It's not just the diet that we're changing. We are changing a lot of aspects of our lifestyle. We've gone into detail about this more in other videos about what all we're doing, but it's all of these different metabolic therapies at play here that we're really committing to. And I think the key here that makes it easier to comply with, if you want to use that word. I don't really like that word for therapeutic stuff, but whatever.
Sorry, it's the medical
jargon. What makes it easier to follow is if you have buy-in. And so, I started this project with the idea, the hope maybe, that this could completely alter for the better my experience of my mental illness, which can be debilitating and really, really difficult to manage. And that allowed me to really dive in fully and commit myself fully to trying this out. And now I'm experiencing benefits, which is kind of like positive reinforcement to keep going with this. And I think that might be something that's actually different with our experiences, and why you might be struggling with it a little bit more in terms of feeling like it is cumbersome and a little tedious to go through all these things and track your food and all these things that it entails. Because I am experiencing very real benefits and changes in my mental health that feel really good and I want more of. And so I am kind of fully on board with continuing to do these interventions and these metabolic therapies. Whereas you don't have that like shift in your mental health because you didn't have schizophrenia to begin with, or schizoaffective disorder. And So perhaps there's less impetus for you to do it or less buy-in from you. And so I'm putting words in your mouth. What do you think?
I mean, I feel like I've had more of the kind of like keto flu symptoms.
Yeah.
So that's where I'm still at in terms of kind of working through that.
Yeah.
So, I mean,
but you
I
haven't
support
had any
you.
positive reinforcement yet.
I mean, beyond like reduced inflammation in my body.
For your old achy joints.
Yeah, for my old achy joints and sort of somewhat unwanted weight loss.
Yeah.
I haven't had the same level of net positive effects.
I guess what I'm trying to get at is like, if you can understand that this is a very serious medical treatment option for dealing with, managing, and recovering, perhaps, if I could be so bold as to say that, your mental illness, then there's a lot more chance that you'll be able to follow it and it'll feel a little bit easier.
You know, I think another aspect here too is just, this is really just the start, I think, of your approach to metabolic treatments. I mean, and maybe that's not fair to say because you are kind of an amateur athlete, like you know, you run, you play soccer, you swim, like you're in excellent physical shape.
So I was already doing some metabolic
so you already have
therapies.
that kind of metabolic therapy there going on, and you're going to only increase that from there.
I think something else,
but not everybody has that, right?
well, something else that is a bit of a metabolic therapy that I've inadvertently fallen into over the past several years is around social fulfillment, social engagement and stuff. Like before I met you and our kids, I dealt with a lot of isolation. And I think that was really difficult on my mental health. And over the past, however long it's been, 6 years, being with you and our kids, I feel like I've really come into a healthier space with my mental health. And I think that is a really big factor in terms of that. And I've never really thought about it like that, as that was actually probably impacting my metabolic health through social engagement and play with the kids and that sort of thing. That is something that I was also engaging in. Something that there's definitely room for improvement on too. I don't make enough time for friends, and we do make quite a bit of time for family, but something to explore more. But that is also another metabolic therapy that I kind of already was reaping the benefits of.
So just bringing things back to kind of like accessibility for other people. You've kind of talked about it from the perspective of like buy-in and willpower, but what about like, and lifestyle change, but what about like kind of like cost perspective? That's a little bit difficult.
It's difficult to gauge costs because I think we're buying less food in terms of keto food because it's very specific things that you can eat, and but things like meat is more expensive for sure. But we're also still buying all the other stuff because we're still feeding our kids regular diets. So it's hard to separate that and know exactly how much we're spending on keto and if it actually is more expensive or not. Obviously, like whole foods, organic foods are going to be pricier. I don't know if you need them or if you know, I'm not sure about that. I think that's probably something to explore in its own video, is keto on a budget and what the finances of this intervention look like.
I think it might be less expensive than people would imagine.
I think so too. Yeah.
Yeah, especially since you can't eat as much vegetables as you may think you can or may think you need. So it's more like your most expensive thing is probably like good quality fats.
Yeah.
And yeah.
You go through a lot of butter.
You might need more protein than you're typically used to. Yeah, good butter.
Yeah.
So this was kind of a bit of a catch-up video in terms of what we've been doing and how you've been feeling and that kind of thing lately.
It seems like it's been moving really fast, and so we wanted to kind of pause and take a snapshot of where we're at this point in time.
Mm-hmm. But we're still going to be kind of focusing on obviously like the keto aspect, and we want to, in particular, I think it's important to be showing more like of what we're eating and what we're doing with the keto aspect, but we're also going to be focusing on the like exercise, the regular exercise component. And you have been tracking your sleep, but it hasn't been something that we've like focused on as like okay, you're going to go to bed at this time every night. You're going to try to wake up.
I think that one's going to be the hardest one for me, is trying to really implement a regimented sleep schedule. I'm not very good at that. I don't like going to bed alone, and you go to bed later than I do, and I don't like that.
I need to go to bed earlier.
He needs to go to bed earlier too, yeah. But, you know, also like having kids, nighttime is kind of your time, and it's hard to give that up. But I think it's important to prioritize that solid sleep schedule.
Recovery, especially if we're like working out more.
Yeah, recovery.
Yeah.
And metabolic health. So those are kind of our next big areas of focus on top of still continuing with the ketogenic diet. Yeah, if there's anything that you want to hear from us or you want to see more of throughout this process, please let us know in the comments below. We definitely want to be showing you guys things that you're curious about, things you want to learn more about. So let us know. Thanks for watching this video. And as always, wishing you and your loved ones good health. I'll see you in the next one. Bye.
Bye.